As we mark 1 year of living with the coronavirus pandemic, News 5 is highlighting the unsung heroes on the front lines. You know, the job's not talked about as much, but no less important. This morning, we're introducing you to a respiratory therapist in Elyria, helping to save lives in her hometown. Nicole Wilbert-Stetak is a respiratory supervisor at Elyria Medical Center.
I don't know that anyone really sees themselves as a hero in this because it takes everybody to help. It's a huge team role.
A respiratory therapist monitors oxygen levels, blood gases, and machine settings. They're the last person a COVID-19 patient sees before going on a ventilator, and the first person they see when they wake up.
With this, we were seeing patients on ventilators 30, 45 days.
That's improved greatly, she says, since the start of the pandemic, as they've learned how best to care for coronavirus patients. But Nicole says she's still learning how best to heal herself.
There are some things that you can never unsee.
It's the human toll, it sounds like, that has weighed on your heart.
Yeah. You don't know if your patients are gonna make it through the night. That's something that weighs on you heavily.
Respiratory therapists have also served as bedside therapists for patients alone due to COVID-19 restrictions.
And you talk to them like it was any of your loved one. If that was your family, you would want them to be, taken care of in the same way.
It's emotional hearing how powerful that connection is for both patient and provider. Its scale and scope this past year, humbling. And it's clear, 1 year later doesn't mean all better for our healthcare workers.
I feel like we're still in survival mode.
They need time to come down. She says talking with peers helps heal.
To have somebody that understands how you're feeling and things that you have seen, it really adds a lot of support to your system.
What makes you feel hopeful?
Knowing that we have learned a tremendous amount about how to care for patients from this. I'm hopeful that in the future we will have the tools we need to help patients recover from this quicker. It will be a huge light at the end of the tunnel.
Make it shine.
Yeah.
We want the brightest tunnel. We're running.
And they still feel like they're in survival mode. That was pretty stunning to hear, but they still live it day in and day out. They can't separate from it. UH does have a support program for its staff and resources to help them cope with the stress of serving on the front lines of the pandemic.
Can't imagine what they're going through. Thank you, Katie.